So I was 13 years old, writing a paper about Emerson in my bedroom, when all of a sudden I felt such a sharp pang of pain in my side that I could hardly find my mom and say, "My side hurts," before blacking out. The next thing I remember is waking up in the hospital. I didn't know it then, but it was going to be the first of many trips. You see, they could say that I had a complex ovarian cyst, but what they couldn't tell me is whether or not that cyst was cancerous without doing risky, invasive surgeries that could have rendered me infertile or risk spreading the cancer to other parts of the body. So began my journey to become a patient to an impatient entrepreneur in hopes that other mothers and daughters didn't have to go through what we did and make the very difficult choices that we did at the time. So from that seeds was born nVision Medical. And really, the dream was to bring focus to women's health, starting by tackling the greatest unmet need impacting women today, and that is developing a tool for early-stage ovarian cancer detection. So why is ovarian cancer so difficult to diagnose in early stages? Well, the symptoms are confounding. Pain, bloating, bleeding. There are many benign conditions that cause these symptoms. So unfortunately, 90% of ovarian cancers are caught in late stages where the 5-year survival rate is less than 15%. I hear physicians again and again say, "We're tired of giving our patients death sentences." Catch this same ovarian cancer early, now all of a sudden, the 5-year survival rate jumps to more than 90%. So think of the impact that a good early detection mechanism could have. So what do physicians have as tools today? What do they have at their disposal to try to find this disease? So first is the transvaginal ultrasound. Now the transvaginal ultrasound will tell you whether or not there is a mass, but not necessarily whether or not that mass is cancerous, especially if it's complex, meaning part of the cyst is solid, part of it is fluid-filled, then it becomes very complex to get sort of a final reading. The other tool that they have at their disposal is a blood test called CA-125. So CA-125 is no better than flipping a coin, okay? In fact, many hospitals in the US do not recommend doing CA-125 if a woman is premenopausal because of the amount of unnecessary surgeries that it causes. Its false positive rate is so high because it basically looks for inflammation in the body, which again can be caused by many benign disease states. And then also its false negative rate when it comes to early detection, so how often it can pick up early detection, early stage cancer is extremely low. So what choices do women have? Well, this impacts certain patient groups even more than it impacts others. So for example, we have Angelina Jolie who has the BRCA mutation. Having the BRCA mutation means that you will have a lifetime risk of developing ovarian cancer of more than 50%. So if there isn't any good detection mechanism for ovarian cancer and your lifetime risk is 50%, what do the physicians recommend that you do? They recommend that you have your ovaries removed. They recommend that the control center of a woman's body should just be removed. To give you an idea of the scale of the problem, in the US alone, there are 20,000 cases of ovarian cancer diagnosed each year. There are 300,000 procedures to remove ovaries. This is how of a dire situation it is. And imagine this. Of course, if you have your ovaries removed, it impacts fertility, right? That's an obvious one. But as I mentioned earlier, the ovaries are really the command center for a woman's hormonal control. So osteoporosis on average develops much earlier in women that have their ovaries removed. Also, your risk of dying from cardiovascular disease goes up 7%. You are much more likely to suffer from depression, sexual disorders, other mood disorders, the list sort of goes on. So this whole thing that if a woman is symptomatic or a woman has this genetic predisposition, just pull out her ovaries, there has to be a better solution than that, right? So what can we do then? What options are there? Well, what if we developed a test similar to the pap smear, where on an annual basis or every few years, depending on the woman's risk profile, she goes ahead and has a test done? Well, this wasn't necessarily possible before, because how are you supposed to access a woman's ovaries in a non-invasive fashion? Well, recent research shows that, in fact, the majority of ovarian cancers actually begin in the fallopian tube. And that makes sense, right? Because if you think of the functionality of the fallopian tube, its job is to grab cells from the ovary and bring it through to the uterus, right? But again, the challenge still remains. How do you non-invasively access the length of the fallopian tube? So when I started this company, that's what really we were focused on. How do we gather these cells? So what we did is create a self-navigating balloon catheter that picks up cells on its surface as it distends the fallopian tube. This can be done in office while the woman is awake. So now if she has symptoms or a mass or is at a genetic predisposition, instead of jumping right to surgery, there'll be another procedure available. We did get our FDA clearance for collecting cells a couple of years ago, and I know that Boston Scientific is going to do an amazing job commercializing this product. So I wanted to talk a little bit about my founder story now that we've heard about the technology, right? You may have noticed that I am not a white male. And just in case, I'll just say it now to make it clear. No, so what really big thing when you're trying to start your own company is what network is pre-existing to you, right? And especially for medical devices, one network that's incredibly important is the number of physicians that you know. I was actually coming from the cardiovascular realm. That's where I went after completing studying engineering and science at UC Berkeley. So I didn't know many gynecologists, and I didn't know many people who could make introductions, but I did know one gynecologist. I knew my own. So in the middle of an appointment one day, hey, I have this idea, what do you think? She was definitely a little bit startled, right? So a little bit change of that physician-patient dynamic, right? So what I can say about that sort of lesson learned, that as daunting as it is when you first go out there and you don't know anybody, right, that you need to raise money from or that you need to talk to validate your product, just go ahead and put yourself out there. And from that one meeting that you didn't think would amount to anything, maybe that person didn't have the best advice for you, but they introduced you to 3 more people who introduced you to 3 more people each, and then eventually you find yourself in front of the right audience. So don't be daunted by that whole, I don't know anybody, how am I going to get this done feeling that's so common that I had as well. The next lesson learned that I wanted to share with you is so fundraising, right? So audiences will have different reactions to different words, right? And there was a word that I had to say a lot in front of these male VCs, right? I walk in, it's like a room of men. I'm trying to talk about this product that is placed through the vagina. It's placed, so then you just take it, you put it in the vagina. And their reactions, right, mixed bag. I'm not a guy, I don't know how this word makes you feel. Sometimes there's a lot of leaning in, sometimes they're pulling out. And I think at that point, right, I started saying the word transvaginal, right? And that made them feel, oh, now you're talking about something medical. So that just made them feel a lot more comfortable, right? So as you're going out there and you're fundraising, you might be talking about something that's not immediately comfortable for people, and just reading that body language and adapting to it, right? So at some point, the press got involved. Total before selling to Boston Scientific, I had raised $17 million in venture funding, and after my Series A round, a very astute, very good male journalist asked me, "Hey, can you tell me some funny stories from when you went fundraising?" And I don't have much of a filter, that might be obvious at this point. And so I told him the vagina story, and then he published an article on it, editor's pick of the week. Okay, so that's the other lesson learned. Pitch to VCs, just don't say vagina. So careful on what you're saying to the press, right? So I just wanted to share a couple of stories, because in these series of talks that's on founders who are killing it, along the journey you definitely don't feel like you're killing it. Like if you're honest with yourself, right? Because you have all of these challenges while fundraising, you have interesting press that comes out. That ended up actually being good for us, I guess. So, but in the end of the day, when you're working on something, you're really putting your heart and soul to it, things work out, right? And so it's only been a couple of months since the exit, and so I'm still reflecting on all of what that means. But one thing is, again, this whole story started with me writing a paper on Emerson. And I was really, really upset that there weren't better options. And I was one of the lucky ones, Raj. I was one of the lucky ones and did not have to have my ovaries removed. Hey, sweetie. So one of the lucky ones that didn't have to have my ovaries removed, but there's so many women that don't have the same luck, right? And so this upset me so much, but instead of staying angry, decided to do something and work on it, right? And it ended up being a really good exit for my investors as well with this exit. Oh, that's a huge picture of me. Didn't really think that one through. This is a pre-baby photo. Let's just be honest here. So it's a great exit for the investors with $17 million in and $275 million in an exit. And and with that, mic drop. Thank you guys so much.